could you please mention another type of the treatment instead of acupuncture, Tai Chi movement, and also herbal medicine that you study?
Yeah.
Hello, Assalamualaikum. Welcome to my channel again with BN Hannover. Today I have a new guest. This is a special guest. He is also my friend. We are now again at my office because we work here actually at Department of Rehabilitation Medicine, Hannover Medical School. And then why I would like to interview him? Because he is so special for me, both in professional and also personal life. And he has a lot of experience related to the traditional Chinese medicine. Maybe a lot of us didn't know what is traditional Chinese medicine. Maybe we only know about the acupuncture, for example. That's all, at least for me, before I met him. But actually, traditional Chinese medicine more than that after I visited China many times. Now, that's why I invited him as a special guest in my YouTube channel. So, first I will ask him to introduce himself. Please.
Hello everyone. My name is Lei Jiang. In Chinese, it's a little bit difficult to pronounce. I am working in Germany for about 10 years. Before I came to Germany, I was working in China as a traditional Chinese clinical doctor. Here in Germany, Boya is my dear colleague. We work together for rehabilitation department.
So see, he already has been here working in Germany for more than 10 years, yeah? And see, he already also worked before as a traditional Chinese medicine doctor in other city, but now he is now in Hannover, Germany. So Lei, maybe you can first inform us, what did you make to come to Germany? Because previously you studied in China, please.
Yes, I had my university time in China, a very beautiful city in northeast China. The city name is Harbin.
Harbin,
yeah, Harbin, quite near Russian. It is one of the biggest and also one of the most important city in northeast China. My university's name is Heilongjiang University of Traditional Chinese Medicine. I had a 5 years long bachelor degree education there. After that, I have a 3-year master degree education for TCM2, also in Heilongjiang University of Traditional Chinese Medicine. And after that, because my personal hobby, I like engineering. Okay. So I get my second degree in Eastern Normal University in Shanghai.
In Shanghai, big city.
Yes, another big city. And that major is for software engineering.
Software engineering, so from traditional Chinese medicine to software engineering.
Not from traditional Chinese medicine to software engineering. It's combination.
Combination. Okay,
yeah, it's combination. That is because in China you can find a very interesting opinion. That is, Chinese medicine is not an old medicine. It won't die. It will never die. It is developing at this moment, just as any other subjects in the university. So this point is quite different from inside China and outside China. Outside China, always they call Chinese medicine is traditional Chinese medicine. But traditional, as you know, in Germany also we have this opinion that is traditional is something old, but good and classical. Okay. But in China, it is Chinese medicine, not traditional Chinese medicine. Yeah. So that is why I would like to learn software engineering and combine software engineering to Chinese medicine together.
So the question still not answered. What did you make your decision to come to Germany?
Yeah, that was because in the year 2012, I presented one of my master degree project. Yeah, that was about the relation between acupuncture and clinic effect.
Okay.
But I used some mathematical model.
Mathematical model.
Yeah, mathematical model. I made this mathematical model with MATLAB. And in this presentation, I'm professor from Hannover Medical School. Heard this presentation. That professor connected me. It's Professor Dankler. In neurology. And that was my opportunity to come to Germany. At that moment, I was not how to say that, PhD degree.
You just finished your master.
Yeah.
But at that time, it was in a congress.
That's right.
In China.
Yeah, that's right. Okay. That's right. So that was the reason I get some interest to come into the neurology field. And another thing I didn't mention, that is in Heilongjiang University of Traditional Chinese Medicine, they have a very very good key subject that was TCM neurology.
Very specialist.
That was in Hospital 1 and Hospital 2, affiliated to Heilongjiang University of Traditional Chinese Medicine.
Still in Harbin, yeah?
Yeah, in Harbin. Their neurology department is acupuncture department. Just in these two hospitals. My supervisor for of master degree was very big master in acupuncture and neurology. So that was why I focus on neurology as well.
See, we now already found out about his interest. Now I also getting more interest with this field, but maybe we can discuss about this field later, because now we would like to learn about his study background and what did he study during the study in the traditional Chinese medicine subject. So Lei, I would like to ask you later to come again. So Lei, because many of us, maybe in Chinese people know, but me as a layman didn't know what did you study in traditional Chinese medicine, because as I mentioned in the beginning that I only knew mostly about the acupuncture. That's all. So could you please elaborate what did you study more in the traditional Chinese medicine when you were in Harbin?
This is quite an important subject topic we should talk. For the subjects I was learning in university, we can easily divide these subjects into three parts. The first part is of course we are Chinese medicine doctors, so we need to learn Chinese medicine. And the second part is clinical Western medicine. That is nearly the same with medicine students learn in Western Medicine University. In Harbin, we also have another famous medical university. Of course, it's Western Medicine. It's Harbin Medical University. The place where I worked after graduation. And the third part is we call it principle basic. Principle basic is philosophy. Because Chinese medicine is based on philosophy. And after this philosophy, we update it. We update it with normal ideas and with scientific methods. Something like what we always do is RCT, a trial, something like this. So I can come into more deeper about for the details. The first part, Chinese medicine is an individual system. It's quite an individual system. just now you mentioned acupuncture. Many friends only know acupuncture, and acupuncture is Chinese medicine, but it's not true. It's not true. Yeah, because acupuncture is a therapy method. It's just a way. It's just a way to use Chinese medicine to treat patient.
Okay.
Yeah, that's just like you buy some medicine from the pharmacy. Yeah, from apotheke. That's right. But do you know how to use this medicine? Do you know why use this medicine?
Okay.
Acupuncture is this medicine. Acupuncture is apotheke.
Okay.
It's a pharmacy. Yeah. But acupuncture points, acupuncture reception is a medicine.
Okay, I see. So the point itself in our body can be the target, the medicine itself.
That's right.
Okay,
that's right. So if you want to know how to use acupuncture, it is not only use needle to push on the body.
Okay.
It's not true. You must learn Chinese. We call it Chinese medicine basic. This is the first one, the first one. And after that, you must learn Chinese medicine diagnostic.
Okay.
And the third one is Chinese medicine, herbal medicine.
Herbal.
Yeah, but herbal medicine is not only herbal medicine. During herbal medicine learning, you can practice how to use the diagnosis and how to use your basic knowledge to make good choice.
And also the dosage of the.
That's right.
Okay.
That's right. After these three basic subjects, we come into the Chinese reception. Herbal medicine reception.
Okay.
Yeah, herbal medicine reception is during the herbal medicine reception learning, we can combine the three subjects we mentioned before.
Okay.
Basic, diagnostic, herbals. Yeah, and then we combine these together in the fourth subject, traditional Chinese medicine reception. And after that, you know all basic. We can say you are a beginner.
Okay.
You are a beginner. And after that, we need to learn inner medicine. Chinese traditional medicine, inner medicine subject. It's quite a thick book like this, and we learn it for 2 years.
Okay.
Yeah, yeah. And in this inner medicine, you can during this learning to know how to use your knowledge to see patient. Okay. To talk with patient, to make differentiation. Yeah, because in Chinese medicine, we never face disease itself. We face disease in differentiation.
Interesting. What does it mean?
That means in any disease we have a sub-diagnostic.
Okay.
Yeah. For example, I get cold. I get cold. In our Western medicine view, cold is cold. We can use some medicine like aspirin or other medical care to treat. But in Chinese medicine, it's not. Cold is not only cold. In the textbook, it is divided into four different sub-diagnostic because of different reasons.
Okay.
Yeah.
Interesting.
Yeah.
So it will take more time to diagnose the patient, and also it will be more specific treatment for the patient, because maybe because of different type of cold as you mentioned.
That's right. Okay. Different sub-diagnostic can lead different therapy methods. Okay. Yeah. Normally we use Chinese medicine reception, but also when you have the clear sub-diagnostic, you can also use another way to treat. That could be acupuncture.
Okay. Acupuncture is one of the methods to this.
That's right. That's right. We have a sentence that is, in acupuncture doctor's hands, acupuncture and points is your medicine.
Okay. Yeah. Okay. But maybe before I continue, how long did you learn this Chinese medicine? This is the one of the three parts.
That's right.
1 year, 2 year, or 3 years?
These three parts, we learn it year by year. It is not when we finish this part, we come to
combination.
It's combination. That's right.
Okay.
That's right.
Okay.
For the basic part, I mean the first 5 most important parts, just I mentioned. From the first year, we learn first semester we learn basic, and the second semester we learn diagnostic. And the third we learn herbal medicine, and then one by one.
Okay.
One by one. This is all the basic. After this, we learn more into deeper about Chinese traditional medicine.
Okay, interesting. Lei, maybe in the beginning I forgot to mention, I knew about traditional Chinese medicine because when I was in Indonesia, I watched quite a lot Chinese drama movie from Kung Fu, also like Jet Li, Jackie Chan, the old movie, and then also maybe they will know my age if I mention about the White Snake Legend. Yeah, because they really use also herbal, acupuncture, and combination, and also I think they also use movement therapy like Tai Chi, for example. Is this also one of the learning subject when you study traditional Chinese medicine?
That's right. In normal university, in some ordinary university, students always need to exercise. For example, morning exercises, or sports. They have sport PE. PE. Yeah, but in our university, that was quite interesting. After the third year, because in the first third year, in the first 3 years, we must learn basic. But from the fourth year, after 3 years, we can go deeper. At that moment, we begin to learn Tai Chi.
Tai Chi.
Yeah, we begin to learn Tai Chi.
Is it part of the curriculum or?
Yeah, it's a part of the curriculum in PE.
Interesting.
Yeah, and everyone must pass this examination. Otherwise, you won't get
the degree.
That's right.
So you should teach me. I really like Tai Chi movement.
Yeah, in China we have many different Tai Chi, different type of Tai Chi. We just learn the basic one.
The basic one, for the student in university.
That's right. That's right. And in morning exercises, in big winter, because in Harbin it's very cold, we run around the ground. But in summer, we make Tai Chi.
Okay, interesting. Yeah. Okay. I think it is quite like maybe could you please mention another type of the treatment instead of acupuncture, Tai Chi movement, and also herbal medicine that you study?
Yeah.